Hi, Lucas. I enjoyed listening to your thoughts about this discussion. For the first question, I like that you mentioned that these alternative therapies are really good to keep in mind for patients that have a history of drug abuse. I didn't even think about that, and I think that's a really good thing to keep in mind because we know that they already have a history of being addicted. So if we used opioids, that would just lead them back into that vicious cycle. I like that you mentioned that being in a hospital is a stressful situation and it's a stressful environment for the patients, and that if we use alternative therapies that are, aimed to help reduce stress, then that would better achieve good outcomes for our patients. As I guess opioids don't really, focus to decrease the stress of our patients. I like that you mentioned that we should use these alternative therapies in addition to our traditional therapies, because a lot of these I don't think you could really always replace our therapies, which not just for pain but like other things. So it's important to use them together so we can get a really good outcome. I like that you talked about opioids kind of opening the door to other comorbid conditions, because that's another thing I didn't really think about. But it just, if you start opioids, it kind of leads to a downward spiral where, you could develop another condition, you can develop addiction, you can develop things that requires other medications, and the more things we put into our body isn't really the ideal way of treating things. So thank you for your post.